This press conference, I am pleased to welcome you.
On COVID-19, driven by BA4 and BA5 in many places, cases are on the rise in 110 countries, causing overall global cases to increase by 20%, and deaths have risen in 3 of the 6 WHO regions, even as the global figure remains relatively stable. This pandemic is changing, but it's not over. We have made progress, but it's not over. Our ability to track the virus is under threat as reporting and genomic sequences are declining, meaning it's becoming harder to track Omicron and analyze future emerging variants.
We have simultaneous interpretation in the 6.
Going forward, to prevent deaths and severe disease, it's important to keep the most at-risk groups up to date with vaccination. In all countries, 100% of at-risk groups should be vaccinated and boosted as soon as possible. For the general population, it also makes sense to keep strengthening that wall of immunity, which helps lessen the severity of the disease and lowers the risk of long or post-COVID condition.
Plus Portuguese and Hindi.
On monkeypox, while the emergency committee did not advise that the current outbreak represents a public health emergency of international concern, they acknowledged the emergency nature of the event and that controlling the further spread requires intense response efforts. They also advised that I should reconvene them quickly based on the evolving situation, which I will do.
Scientist Dr. Abdi Mohammed.
Furthermore, the virus has now been identified in more than 50 new countries, and that trend is likely to continue. I'm concerned about sustained transmission because it would suggest that the virus is establishing itself and it could move into high-risk groups, including children, the immunocompromised, and pregnant women. We're starting to see this with several children already infected.
Hepatitis and STI. Now,
in light of the decision by the US Supreme Court overturning the Roe v. Wade, I want to reaffirm WHO's position. All women should have the right to choose when it comes to their bodies and health. Full stop. Safe abortion is health care. It saves lives. Restricting it drives women and girls towards unsafe abortions, resulting in complications, even death. The evidence is irrefutable. Limiting access to safe abortion costs lives and has a major impact, particularly on women from the poorest and most marginalized communities. Over the last 40 years, the global trend is toward women having greater access to safe abortion, and while last week was a setback, it's important than ever to come together to protect women's right to safe abortion everywhere.
The fact that it supplies...
The countries that have currently stockpiled that vaccine, including the US and led by the US, have expressed willingness to share those vaccine products with other countries. But again, we must remember that these products have been licensed in the main for the use in smallpox. In one case, they've been licensed for monkeypox, but again, based on animal models and based on, I believe, immunobridging data from the smallpox side of things. So it's really important as we encourage the sharing of these products that we also collect the necessary clinical efficacy data.
Talk us through the specifics of why the advisory committee.
Not declaring a FIC does not mean it's not an emergency. It's already a great multi-country, multi-region emergency, and we'll continue assessing the risk based on new information. It's already, assessed at the risk assessed at high in Europe and moderate in other regions. And it's really important to make sure that we continue managing as an emergency. You have an incident management system at global level, but in every 6 region, of the 6 regions. So we continue working, managing as an emergency and making sure that we can work to stop further transmission. So it's really important to not, link the FIC with global emergencies. Already a global emergency, multi-country emergency, and multi-regional emergency. Thank you.
I would like now to invite Dr.